Hello everyone. In this video I am going to discuss about the axillary artery. It's three parts and the branches arises from the three parts and the relations and the cause of the various branches. When we talk about the cause of the axillary artery, it begins from the outer border of the first rib. Here this is the first rib. It begins from the outer border of the first rib as the continuation of the subclavian artery. This is the subclavian artery. And it ends at the lower border of the axilla, or it ends at the lower border of the teres major muscle and continues as the brachial artery. Here you can see the brachial artery. Then this axillary artery is divided into three parts by pectoralis minor muscle. From the beginning or from the outer border of the first rib up to the upper border of the pectoralis minor muscle is the first part of the axillary artery. The part behind the pectoralis minor muscle, or from the upper border of the pectoralis minor muscle to the lower border of the pectoralis minor muscle, this part we call as the second part of the axillary artery. From the lower border of the pectoralis minor muscle up to lower border of the axilla or lower border of the teres major muscle, we call this part as third part of the axillary artery. When we talk about the branches arises from the each part, from the first part of the axillary artery, it gives only one branch, that is superior thoracic artery. From the second part, there are only two branches. Those are acromiothoracic trunk or thoracoacromial trunk and lateral thoracic artery. From the third part, it gives off three branches as subscapular artery, anterior circumflex humeral artery and posterior circumflex humeral artery. So you can remember easily the number of branches arising from the each part is correspond to the number of the part. That means first part gives only one branch, second part gives only two branches, third part gives only three branches. These branches of the axillary artery supplies the chest wall as well as the shoulder joint. Here you can see there is a small branch. This branch is the superior thoracic artery, which is arise from the first part of the axillary artery. Here this branch you can see, this is the thoracoacromial trunk. We call it as a trunk because it gives four another branches. You can see, you cannot see the origin of this thoracoacromial trunk because it is, the origin is posterior or behind to the this pectoralis minor muscle. Here you can see the lateral thoracic artery, the beginning, the starting point of the lateral thoracic artery also you cannot see here because it is behind the pectoralis minor muscle. Here you can see the subscapular artery. Here you can see the anterior circumflex humeral artery. And here you can see the posterior circumflex humeral artery. Here you can see this is the axillary artery and this is the brachial cords of the brachial plexus. This is the axillary vein. Throughout the course of the axillary artery, the artery is closely related to the cords of the brachial plexus and its branches, and it is enclosed with them in a connective tissue sheath called axillary sheath. If this sheath is traced upward, if this axillary sheath traced upward into the root of the neck, it is seen to be continuous with the prevertebral fascia. There is prevertebral fascia in the neck. So this axillary sheath seems to be continuous with the prevertebral fascia. When we talk about the relations of the first part of the axillary artery, anteriorly you have pectoralis major muscle. Here the pectoralis major muscle has been cut. Here you can see the cut edge of the pectoralis major muscle and the skin is anterior. And also the cephalic vein crosses the axillary artery. Here you can see the cephalic vein. Here this is the cephalic vein. it crosses axillary artery anteriorly. Posterior to the axillary artery, you have long thoracic nerve. Here, this is the long thoracic nerve. In the upper part also, you have the long thoracic nerve posteriorly. And then laterally, there are three cords of the brachial plexus. In the upper part of the axillary artery, all the three cords of the brachial plexus is lateral. Some book says that the all three cords of the brachial plexus is posterior to the first part of the axillary artery as well. So the axillary vein is a medial relation of the first part of the axillary artery. So again, the relations of the first part of the axillary artery, anteriorly you have the skin and pectoralis major muscle as well as the cephalic vein. Medially you have the axillary vein, laterally you have the cords of the brachial plexus, and posteriorly you have the long thoracic nerve. When we talk about the relations of the second part of the axillary artery, anteriorly you can see the pectoralis minor muscle, then pectoralis major muscle as well as the skin. Then posteriorly the posterior cord of the brachial plexus and the subscapularis muscle as well as the shoulder joint is a posterior relation. Then laterally you have the lateral cord of the brachial plexus to the second part of the axillary artery. Medially, the medial cord of the brachial plexus and the axillary vein. Again, the relations of the second part of the axillary artery. Medially you have axillary vein and medial cord. Laterally you have the lateral cord. Anteriorly you have the pectoralis minor muscle, pectoralis major muscle and the skin. Posteriorly you have the posterior cord of the brachial plexus, subscapularis muscle and the shoulder joint. Then the relations of the third part of the axillary artery. Anteriorly there is pectoralis major muscle only for a short distance. In the lower part of the lower part of the third part of the axillary artery, the medial root of the median nerve crosses anteriorly to the third part of the axillary artery. Then posteriorly there is subscapularis muscle. Here you can see this is the subscapularis muscle, latissimus dorsi muscle and teres major muscle. Axillary and radial nerves also lies behind the artery, third part of the axillary artery. Laterally there is coracobrachialis muscle, biceps muscle and the humerus. Here you can see the bone. And the lateral root of the median nerve and the musculocutaneous nerve also lies on the lateral side of the third part of the axillary artery. In the medially there is ulnar nerve. Here ulnar nerve and the axillary vein and the medial cutaneous nerve of the arm. Again, the relations of the third part of the axillary artery are anteriorly there is pectoralis major muscle and the medial root of the median nerve. Then posteriorly there is subscapularis muscle, latissimus dorsi muscle, teres major muscle and axillary nerve and radial nerve. Laterally there is coracobrachialis muscle, biceps muscle and humerus. Also, the lateral root of the median nerve and the musculocutaneous nerve is the relation of the third part of the axillary artery from the lateral side. Medially there is ulnar nerve and axillary vein as well as the medial cutaneous nerve of the arm. Now we will discuss about the cause briefly. The cause of the each branch which arises from the axillary artery. Here you can see the superior thoracic artery which arises from the first part of the axillary artery, and it is small branch and runs along the upper border of the pectoralis minor muscle and it supplies to the upper part of the chest wall. Then in the second part there is thoracoacromial trunk as well as the lateral thoracic artery. Here this thoracoacromial trunk gives off 4 another branches, and they are the clavicular branch and the pectoral branch, then the acromial branch to the acromion process, and then the deltoid branch to the deltoid muscle. Here this clavicular branch to the clavicle and the pectoral branch to the chest wall. Then the other branch of the second part of the axillary artery is the lateral thoracic artery. It runs along the lower border of the pectoralis minor muscle, and it supplies to the lateral part of the chest wall. Then the branches of the third part of the axillary artery. Here the subscapular artery. Subscapular artery goes behind the scapula and divide into 2 branches as circumflex scapular artery and thoracodorsal artery. Subscapular artery again divides into 2 parts as circumflex scapular artery, which supplies the posterior aspect of the scapula and involves in the scapular anastomosis as well, and another branch called thoracodorsal artery, which runs along the lateral border of the scapula up to here like this. Then the other 2 branches of the third part of the axillary artery are the anterior circumflex humeral artery and posterior circumflex humeral artery. Here you can see they wind around the front and back of the surgical neck of the humerus. Here you can see anterior circumflex humeral artery goes in front of the surgical neck, and the posterior circumflex humeral artery goes backward and winds posteriorly around the surgical neck, and they anastomosis with each other. Here also you can see an anastomosis between the circumflex humeral anterior and posterior circumflex humeral arteries and the thoracoacromial trunk, acromial branch of the thoracoacromial trunk. Here also there is an anastomosis. These anastomoses are very important if there is a block in this part, if there is a block or if there is arterial damage or arterial constriction in this part, so the blood can come from this way and goes from the brachial artery. So that's all about axillary artery. Thank you for watching. If you like my video, please subscribe and put a comment in the comment section as well.